Hi, and welcome to the NJ Life and Health video on how Medicare prescription drug coverage works. So let's dive in. Every drug plan has four basics that we need to know to understand how a Medicare drug plan works. And those four basics are going to be the premium, the formulary, drug tiers, and drug coverage stages. So one at a time, we're going to go through these so we really understand how a drug plan works. Now, first and foremost, every drug plan that's a standalone drug plan with Medicare is going to have a monthly premium. If you're in a Medicare Advantage plan, the drug coverage will work the same, but there will be no monthly premium attached. Okay, nice and easy. Number one, every drug plan has a premium. Premiums can range from as little as $6 all the way up to $100 a month. And the drugs that you take are going to actually funnel you towards one drug plan or another and affect the drug cost or the premium of your plan. So again, to repeat, Medicare standalone drug plans have a premium. Medicare Advantage drug plans typically do not. And those premiums can range anywhere from $6 to $100 a month. And the drugs you take are going to funnel you towards one plan or another that will affect your premium. Okay. Now, number two, formulary. This may be the most important part of any Medicare drug plan, which is the formulary. And a formulary is a list or a book of covered medications. Let me repeat that. A formulary is your book of covered medications. Okay. Now, this is your guide or this is your holy grail to the drug plan. Okay. Always bring it with you to the doctor if possible. When you do sign up for a Medicare drug plan or a Medicare Advantage plan, reach out to that carrier and ask them to send you or mail you a copy of the formulary, or we can send you an electronic copy of your formulary. If you are going to the doctor and they need to prescribe a new medication, by having a copy of your formulary on hand, you'll have a copy of your covered drugs so that the drugs you are prescribed are always covered by your carrier, okay? Now, here's the good news. No matter the price of your drug plan, all the formularies typically have around the same amount of drugs. You typically see each formulary covering about 3,000 medications. So that helps dispel the idea that the more you pay for a Medicare drug plan, the more drugs are covered. When people first see that huge difference in premium, they think, well, cheap plans must not cover that many drugs. That's not true. Every single drug plan has around 3,000 medications in their formulary. And by law, every single drug plan must have coverage for brand name and generic drugs and drugs in every therapeutic category, which means every plan has coverage for every type of medication. Okay, there will not be a drug plan out there that just doesn't cover diabetes drugs because it's a cheap plan, or it doesn't cover cholesterol medications. They have to by law, and these plans have to cover brand name and generic drugs. So again, it's not as if the cheaper plans don't cover brand names. It's law that they have to. Okay, so as we continue, and as I've already mentioned, this means that every plan will have coverage for every single type of drug, whether it's blood pressure, cholesterol, diabetes, depression, thyroid issues, they will have coverage for those types of medications, okay? So that's our formulary, which is our book of covered drugs. I highly, highly recommend that you get your hands on one if you do have a drug plan so that you can bring that with you to the doctor to know what drugs are covered for you. And knowing that all formulary have coverage for brand name and generic drugs and every type of medication that exists, okay? Now, here's a good example for people on how a formulary will determine what drug coverage or what drug plan is best for you, okay? Because every formulary out there is going to cover brand name and generic medications. They're all going to cover blood pressure medications, for example, but every formulary is going to cover different medications, and that's where the plans differ, all right? For example, if there are, say, 30 blood pressure medications that exist in the world, some plans may choose to offer these blood pressure medications, and other plans may choose to offer those blood pressure medications. Both will have brand name and generic alternatives, but depending on what blood pressure medication you were to take, hypothetically, is going to actually funnel you towards one plan or another. Again, if there are 30 blood pressure medications, maybe some companies cover these 15, and other companies cover those 15. So depending on which medication you take is going to funnel you towards one plan or another, okay? So in summary, because the formularies choose which drugs they want to cover, the drugs you take are going to funnel you towards one formulary or one plan or another, okay? Now, to summarize where we've come to so far, every plan is going to have a monthly premium if it's a standalone plan. Medicare Advantage will not. They're all going to have a formulary or a list of covered medications. They're going to have brand name and generic drugs covered. And I cannot stress it enough, when you get into a Medicare drug plan, or if you already have one, bring your formulary along with you so that any new drugs you're prescribed are on your list, all right? Now, that was 1 and 2, premiums and formulary. Let's move on to number 3, which is our tiers. And the tiers are very simple, okay? Typically, they tier your drugs 1 through 5 to determine how generic and brand name they are and the cost associated. Here's something very easy to remember. The lower the tier of your drug, the lower the price. And the higher the tier of your drug, the higher the price. Let me repeat that. Every single drug plan is going to tier your medications, and typically, the lower the tier of the medication, the lower the price. The higher the tier of the medication, the higher the price, okay? There's one exception to this rule. Just in these past 2 years, some drug companies have started to adopt what they call tier 6. And tier 6, although being the highest tier, doesn't mean it has the highest price. It's actually reserved for very common maintenance medications or common diabetic medications that are given at a capped cost. For example, some companies tier 6 drugs are $0. Some companies tier 6 drugs are $11. They can never be more than $35. And this category is truly built for some of those insulins that we hear that they've got an insulin cap these days that caps the price of insulin for seniors. That's where tier 6 comes into play. So typically tiers 1 through 5, the lower the tier, the lower the price, the higher the tier, the higher the price, leaving tier 6 on the back end as an exception there for more common or diabetic medications that are funneled into that category. Okay. So here's a simple visual for you guys. All right. Tier 1, tier 2, tier 3, tier 4, all the way up to tiers 5 and 6. The lower the tier, typically the more generic, and the higher the tier, typically the more brand name. The lower the tier, the lower the price, and the higher the tier, the higher the price. Now, keep in mind, just because a drug is generic does not mean that it will always be a lower tier. There are some generic medications that fall into the higher tiers, okay? Again, just because a drug is generic does not mean it will always be a lower tier. Some generic drugs do fall into the higher tiers, okay? As a summary, companies will tier your medications to determine the copay. And you can always check your plan's formulary or your book of covered drugs to see the tiers of new medications you might have to take. All right, so that was number 3, drug tiers. And as we summarize again here, number 1, there's a premium. Number 2, there's a formulary or book of covered drugs. And number 3, there are tiers. Low tier means low price and high tier means high price. Now, on to our last piece, the coverage stages, okay? Every Medicare drug plan is going to have 4 coverage stages that will affect your costs throughout the year. Let's go through what those are and see if these are going to affect you, all right? So stage number 1, in most plans, is the annual deductible stage. Some plans don't have a deductible, so this stage won't exist. But for the majority of plans, there is an upfront deductible. And that deductible is typically around $505. Now, if your plan has a deductible, what that means is you pay the full cost of the drug until the deductible is met, okay? In some plans, there is no deductible on tier 1 and 2 medications. In some plans, that deductible only applies to tier 3 or higher medications. Again, let me repeat that. In some plans, there is no deductible on low tier drugs. There's only a deductible on higher tier drugs, okay? Now, if you have to meet this deductible or if you don't, we move on to stage 2, which is the initial coverage phase, or what I like to call the copay phase, okay? In the copay phase, you just pay a copay based on the tier of your medications. Low tier, low copay, high tier, high copay. Again, in the copay phase, you'll just pay the copay of your medication based on the tier, low tier, low copay, high tier, high copay, all right? For some people, that's all they have to deal with the entire year. But this is not the end of the picture, okay? If for any reason you cost your company more than $4,600, all right? The number is $4,660. If for any reason you and the company spend more than $4,660 on medication, that's taking the retail cost of the medication into play, they're going to move you out of the copay phase and into the third phase, which is the donut hole. Okay, again, if you cost the company more than around $4,600, they're going to take you out of the nice copay phase and put you into the third stage, which is the donut hole. And in the donut hole, very simply, you got to pay 25% the cost of your medications. All right, that takes a $1,000 brand name drug, which you were paying a $40 copay for, and brings it up to 25%. You know, a $1,000 drug, you could be paying $250 each month for. So the donut hole definitely stinks, but at least we know why it comes on and when it's going to come on. When you spend, or you and the company spend more than $4,600 on medications, they move you into the donut hole and charge you 25%. Okay. When the cost spent exceeds $7,400, they move you into the final stage, which is catastrophic, and you only pay 5% of the cost. Now, here's some good news. As of 2024, the catastrophic phase will go down to 0%, meaning if you make it out of the donut hole, you're done paying. And even better, in 2025, they're going to put a $2,000 out-of-pocket max on this whole scenario, meaning you can never spend more than $2,000 on medications throughout the year. That typically will have the donut hole end about halfway through and the cost be no more after that point. So again, really good news there. But as for our coverage stages summary, we've got the deductible first, usually on higher tier drugs only. We've got the copay phase, where you pay a copay based on the tier. We've got the donut hole, which when you cost the company too much money, they'll charge you 25% instead of a copay. And then the catastrophic, which they'll only charge you 5%. Now, let's summarize everything we've been through, okay? Every drug plan has a formulary or a list of covered drugs. We use the tiers of those drugs to determine the copays: low tier, low copay; high tier, high copay. Again, lower the tier, lower the price; higher the tier, higher the price. And the coverage stages are going to determine your cost throughout the year. All right. Your drugs that you take are going to actually funnel you towards one plan or another based on what drugs that plan covers. And that is exactly what we are here for. When we first sit down and do a meeting, we will run all of your medications, if any, against all the carriers out there to determine which carriers cover your medications. And once we've determined such a thing, well, then we can help you figure out of the carriers that cover your medications, who does it for the best cost for you. And each year, if necessary, we can always rerun through that with you, especially if your medications change, because every year between October and December, you'll get the right during the annual enrollment period, which runs October 15th to December 7th, to switch your drug plan for the following year. So if we're able to see that there's a plan that covers your medications at a better price, we can make the switch. If your medications just aren't covered under your formulary, we can make the switch. All right. So if you guys need, please feel free to reach out. My name is John from NJ Life and Health Insurance. We've got an entire team of agents here and ready to help you. Please feel free to give us a call at 848-226-6897. Or you can go ahead and visit our website at www.njlifeandhealth.com. Again, that's 848-226-6897. Website is www.njlifeandhealth. Hopefully you guys enjoyed the video today.